Hello and welcome to Eating Well with Cancer. I'm Jo Porter. I'm a dietitian working at University Hospitals Bristol and Weston, and this presentation is part of the First Steps Health and Wellbeing sessions. I'm going to talk to you today about how eating well when you have cancer can benefit you. Eating well is about giving your body the fuel that it needs to stay well and recover at its best. More specifically, it can help to supply your body with the nutrients it needs to prepare your body before it undergoes what can be quite a testing time. And we know that maintaining weight and eating well before and during your treatment can actually help you cope with treatment and its side effects. It can help to heal, recuperate, and have more energy to recover. It makes you feel good, and eating well can also give you a feeling of control and achievement when you know you are doing something to help yourself. It also gives the body the tools to help tackle and recover from immunity threats such as infections. So what does eating well mean? Eating well means eating a variety of different foods from different food groups in order to obtain the nutrients we need. The Eat Well plate on this page categorises foods into subgroups to help guide you to eat a healthy, balanced diet. We will also relate this to the dietary recommendations of the World Cancer Research Fund for Cancer Prevention. The green fruit and vegetables section makes up a third of your daily intake. You're encouraged to consume a minimum of 5 portions of fruit and vegetables per day. If you're able to have more than this, research has suggested that there may be some benefits in doing so. But if you don't manage 5 at present, then any increase you're able to do is helpful. This can all include fresh, frozen, tinned fruit and vegetables count too. As part of this, you may also include 1 portion of dried fruit and 1 portion of fruit juice. The yellow section is made up of carbohydrate-based foods and also forms about a third of your daily intake. This could include bread, rice, potatoes, pasta, cereals, for example. If you're able to choose whole grain or higher fibre varieties, these are preferable for many people unless you've been told otherwise by your specialist nurses or doctors. Protein-rich foods are shown in the pink section. Examples include meat, fish, beans, pulses, corn, soya products, and eggs. Aim for 2 portions of fish a week, ideally one of which should be oily. Try to avoid processed meats where possible and consume no more than 350 to 500 grams of cooked red meat per week. Red meat is allowed in moderation as it's a good source of dietary iron. Dairy and alternatives are displayed in the blue section. Try to have 2 to 3 portions of these foods per day, as these foods are rich in calcium, which are really important for our bone health. When choosing alternative milks, do be mindful that many have far less protein than cow's milk and are not nutritionally equivalent, as they do not naturally contain calcium, iodine, and vitamin B12. So try to ensure that dairy alternatives are fortified with these nutrients. Fortified soya milk is the closest nutritionally to cow's milk in terms of protein. Oils and spreads form the smallest section of the Eat Well guide. This is because they are the most energy-dense foods. We need very small portions to obtain the nutritional benefits from them. And if we eat too much in excess, it can lead to weight gain. Try to choose monounsaturated varieties where possible, and these include olive oil and rapeseed oils, which are usually easy to come by in the supermarkets. Fluid is really important for hydration, which keeps you well. Good hydration levels can also help with energy levels and concentration. Everybody should aim to have at least 6 to 8 cups per day. You may need more fluid if you're going through cancer treatments, for example, chemotherapy, or if you're experiencing symptoms of diarrhea, vomiting, and constipation. Alcohol doesn't count towards your fluid intake and should be limited. The high-fat, high-sugar foods are positioned on the left side of the plate, and if we eat a lot of them, they can contribute to weight gain. However, generally speaking, these foods should be limited with a normal, healthy diet. Although side effects of cancer and its treatment can include a poor appetite and an unintentional weight loss. If this is the case, it is more important to ensure that you are taking in sufficient nutrients so you may need to rely on these higher energy foods more heavily in the short term. And normal healthy eating can be resumed on completion of treatment or restoration of a healthy weight. The Eat Well guide offers advice on how to balance your diet. During treatment, you may not be able to achieve this balance with every meal. However, trying to do this over the course of a day or a week will help to ensure you are well nourished. It's important not to lose weight, even if overweight, prior to or during cancer treatment, unless you've been advised by a healthcare professional to do so. Losing weight, losing significant amounts of weight unintentionally can affect your ability to cope with treatment and your recovery, even if you are overweight. If you are overweight, then this can always be addressed on completion of treatment should you wish. If you're not experiencing any difficulties in eating, then it's best to try and follow a healthy balanced diet as described on the previous slide. Depending on your cancer site and potential treatment, your clinical team may advise you on a specific diet to help prepare you for treatment or to manage side effects of such. Please make sure you seek help if you're eating significantly less than normal for you and you're losing weight unintentionally, or if the cancer treatment and treatment related side effects such as poor appetite, taste changes, sore or dry mouth, nausea or vomiting, diarrhea, chewing or swallowing difficulties results in a diet that is restricted or lacks variety. Or if you have any pre-existing medical conditions which affect your diet and you would like some tailored advice for that. Food is a way that we show we care, so when we are unwell, people often offer to help in this way. Sometimes it is difficult to enjoy these foods when you're experiencing treatment side effects or symptoms of cancer, and this can sometimes lead to conflicts. It can be helpful to explain to those caring for you how you are feeling and how they can help. This can be just simply offering smaller portions more often, offering the types of foods you fancy, changing the texture of foods, for example, serving softer foods with sauces. People often want to help people often want to help, so consider asking them for other things that like taking you to the shops or appointments, reading to you, or giving you a massage, or taking you to an old favourite spot. This can help to take the pressure off you eating and can make people feel useful, as well as being an enjoyable way to spend time together. Choosing good information sources is really important, particularly when using the internet. There's so much poorly evidenced information readily available, which can be misleading, confusing, and harmful to the health. I've included some reliable and evidence-based web pages on the next slide. A good place to start is our website, the UHBU website, which is linked on the page. You'll find our resources there, as well as links to other reputable websites and support groups. And you can also download our booklets written by dietitians and healthcare professionals in the Bristol and Western hospitals, Penny Brohn and Macmillan. The first one being Eating Well During Cancer Treatment, which covers healthy eating, food safety, and answers some frequently asked questions. And the Eating Well When Eating Becomes Difficult booklet offers information on coping with treatment side effects such as a poor appetite, eating with a dry or sore mouth, and taste changes, fatigue, and changes in bowel habits. Here are a list of some of the websites we would recommend. And if you would like some recipe ideas, there's lots on the Macmillan website and also on the World Cancer Research Fund, which also has some specific recipes for people with taste changes. For some more tailored advice, our team of dietitians here at Bristol and Western will be happy to support you. You can download our self-referral form from the website or ask a healthcare professional to refer you on your behalf. We can offer outpatient appointments, including telephone and video using Attend Anywhere, so you can have your appointment from the comfort of your own home. And there are also dietitians who can see you if you're admitted to the hospital, and the nurses will refer you then. Thank you for listening. I do hope you found some of this information useful today. For more information, do have a look on our website. Thank you.